For adults, for the most part, any heart problem is going to be one of two things. It's going to be sudden cardiac arrest, which is like an electrical problem. So like maybe you touch the electrical outlet and it throws off the electrical signals in the heart. Or you're actually going to have a heart attack, so a blockage in the coronary artery, all right? Also known as like coronary artery disease. There's a blockage, so this happens over time. If you don't take care of yourself, you eat bad, just plaque starts to build up in the coronary arteries. It causes a blockage, and this can create a heart attack, okay? So some of the things to worry about when it comes to actual CPR on adults is putting the adult flat on the surface. So we always want the adult on a hard surface to actually do any type of CPR. We usually want that for any patient, but definitely adults. But in reality, some people may do pediatrics in their arms. I always recommend that you put the patient on a hard, flat surface. When we actually go and check on our patient first, we always want to try and use some verbals. So if this patient has a name, address them by their name, or if it's a loved one, address them by their name. And if they're not responding, what we're going to simply do is try to tap on the shoulders, okay, to elicit a physical response. If they're still not responding, after we do that, we want to actually go ahead and check for the heart rate and respiratory, okay? So we're going to be looking for rise and fall of the chest, and we're going to take our hands, 2 or 3 fingers, of course, no thumbs. And check right here along the carotid artery, all right? So if you just follow the jawline down, you can simply press right here, and you're just gonna do this for about no longer than 10 seconds. If you don't feel a heartbeat within 10 seconds or even see their chest rise and fall within 10 seconds, you should probably definitely call 911. I say this because essentially we always wanna call 911 first, just because this is 10 seconds that we've now wasted where we could have called 911. So if you're always by yourself and for whatever reason you doubt whether or not your loved one or this innocent bystander that actually needs medical attention, just call 911. Get them out here. Let's get someone actually trained to check them out and make sure that they're good to go. I always want additional resources helping me out, always. You should never want to always take on things by yourself. Always ask for help. So call 911, put it on speaker real quick, and then get some people out here so we can have additional resources on scene. If we have determined that our patient now doesn't have a heartbeat and is not breathing and in need of CPR, we're actually going to go ahead and start compressions. One, we're going to talk about hand placement, and we're also going to talk about what we need to do to establish an open airway, okay? So a way in which we would do this is called a head tilt chin lift, all right? So a head tilt is simply, I'm going to place my hand on that patient's head and simply move their head back while utilizing my other hand to tilt their chin up, okay? I'm going to take these 2 fingers closest to the nose and I'm going to pinch them so I can actually do an effective rescue breath. When I do my rescue breath, I want to create a seal around their mouth, okay? We're going to pinch the nostrils together while we do this, and then we're going to go mouth to mouth to actually give an effective rescue breath. What we're simply looking for is rise and fall of the chest. That's it. So if in fact we don't get rise and fall of the chest on the first one, that still counts as 1 rescue breath. So all we would simply do is reset and then try to do a head tilt chin lift again and then give another rescue breath. If it doesn't happen, then that might be a blockage in the airway. And if you don't have the proper tools on hand, then there's almost nothing we can do there. Paramedics will fix that when they arrive on scene. Now what we're really going to focus on is chest compressions, okay? Because we can't minimize time off the chest just to try and deal with an airway blockage. So these are a few steps just to keep in mind. When we go to chest compressions, real quick before we actually go into hand placement, we're actually going to worry about something, all right, which is this right here. We're going to talk about this little section underneath the V-notch, which is called your xiphoid process. All right, it's just a small bone right here, but if we go too far down on our hand placement, we might actually risk breaking it off. So we never want to cause any additional harm to our patients. We always want to do the greatest amount of good while causing the least amount of damage. Now, when doing CPR, broken ribs are common. But if we can avoid trying to break this off, then that's always good. So and the way we do that, our hand placement should line up right here where their nipple line is. So I usually like to take my middle finger, all right? You can use left or right hand to start, it doesn't matter, all right? So I'm gonna go right here in the middle, all right, not too far on either side and not too far down. So again, the xiphoid process is right here. So if you look at my hand, all right, and then I go over, I'm actually not on the xiphoid process at all. And then again, we never wanna lean on the chest because it doesn't allow the chambers to actually fully open up, allowing blood flow to go in, all right? So we wanna be over it directly with our arms straight. And then we're just going to use our body weight to actually give a good compression while coming up. This allows for a good pump of the heart, and then we're allowing the chambers to open back up to let blood flow come back in. So it'll simply look just like this. And again, my arms are straight, my shoulders are directly over. I'm not leaning on the chest. My hands don't do any type of flopping motion, okay, at all. And we're giving nice, effective chest compressions. In terms of what we're looking for is, we always want to go at least 2 inches. So we have to go pretty deep to actually give effective compressions. So we're always going to go at least 2 inches. Even if you break a few ribs while doing this, this is all actually very common when doing CPR, so don't stop, okay? And of course, we always want to minimize time off the chest. So we want to have a reason towards why we're not doing chest compressions. And some of those reasons would be paramedics have showed up, so they're taking over, or you're doing a rescue breath. And again, our rescue breath should take about 10 seconds to go from chest compressions to rescue breaths and then back again.